Hello, and welcome to this educational presentation on migraine. Migraine is a chronic disease that affects over 1 billion people worldwide. So if you're somebody that's affected with migraine, you're not alone. Migraine can be debilitating and impact both the patient and their families. And on top of that, migraine is responsible for a significant amount of days lost from work. Therefore, it's both a direct and indirect cost to our economy. So the aim of this presentation is to empower you with knowledge so that we can improve your overall care for migraine. My name is Dr. Firoz Shiraz. I'm a pharmacist practicing here in Victoria, British Columbia, and I have special interest in diabetes, migraine, asthma, and COPD. I would like to acknowledge that this collaboration between myself and Dr. Corey Grabowski was made possible through industry funding from Teva, Eli Lilly, and Miraval. Here's some general disclosures. This presentation is really for educational purposes only. For any medical advice, you should be speaking to your healthcare professional. And again, the aim of this video is to enhance your overall understanding of migraine management. This presentation again does not endorse any specific pharmaceutical products or companies. So I'd like to start off by explaining the difference between a migraine and a headache. Migraine is usually one-sided, but that's not always the case. In migraine, the pain is usually pulsatile in nature. It's usually more moderate to severe compared to a headache. Migraine is usually worsened by exercise or movement. There can be nausea or vomiting present. There can be light and or sound sensitivity that is frequently present in migraine and only sometimes present in a tension type headache. A migraine usually lasts about 4 or 72 hours, whereas a headache is usually about half an hour to days. But most patients are typically functioning, able to do their work and their activities during a tension type headache. I do get asked the question, what causes migraine? My short answer is usually we still don't know, unfortunately. We used to have all these theories. Now what we think is that there's some key players that can contribute to migraine, such as cortical spreading depression, the trigeminal vascular system, which are the nerves of the face, they get activated. There's sensitizations that can happen as well. And one of the other key players is called calcitonin gene-related peptide, or CGRP, which is a neurotransmitter, so a messenger in the brain that plays a key role in migraine. And a lot of the newer migraine medications that are out there do target this to help stop migraine. So let me break down the migraine attack in a couple of the phases. So we have the prodrome, the aura, the headache itself, and the postdrome. So the prodrome is a phase where it's more like a warning sign that a attack is about to happen, generally within 2 to 48 hours. In this phase, some patients may experience neck stiffness, fatigue, mood changes, feeling irritable, or even craving for certain foods like chocolate. So we used to think that having chocolate would trigger the attack, but now we believe is that if you're getting a strong craving for chocolate, it could be a sign that a migraine attack is about to happen. So be ready with your medication. So the next phase is the aura phase. Not everybody gets an aura, but only a third of patients with migraine get an aura. The typical symptoms that patients will experience that have an aura is the visual symptoms, where their vision changes. There can be spotting or even tunnel vision. There can be other symptoms as well, like tingling in other body parts as well. The third phase is the attack itself. Again, they last about 4 to 72 hours. And patients describe their attacks as like drill picking in the head, or ice pick in the head, throbbing, sharp pain. But there can be also other symptoms like nausea, vomiting, light and or sound sensitivity that render them unable to function. And the last phase is the postdrome phase. So the postdrome is we have fought the attack, you're worn out, fatigue, and a lot of patients will describe this as feeling hungover. So you're again unable to fully function. And an odd phase over here is the interictal phase. So this is a phase or a period between migraine attacks. So you're not having any attacks. And in these phases, many patients have told me that they feel anxious. So what I wanted to point out here is that the burden of migraine is significant, and it can have a lot of impact on the patient and their families and reduce the overall quality of life for the patients. One way that we classify patients with migraine is depending on their frequency. So we classify them as episodic or chronic. So we can say that somebody has episodic migraine if they're experiencing less than 15 days of headaches per month, whereas we will classify somebody as having chronic migraine if they have 15 or more days per month of headache, and of those, 8 are migraine days. So it's very important to record your migraine days, which I'll go over in the next couple of slides. All right, so when we're talking about migraine treatment, our approach is to focus on the 3 pillars of migraine treatment, which is the lifestyle modification and trigger avoidance, and then add on acute therapy and also preventative therapy if it's necessary. When we're talking about lifestyle modification, the bottom line really is to keep everything consistent. So that would be focusing on making sure that you're not missing any meals. So keeping your diet consistent, exercise, not too much, not too little, sleep hygiene, so getting up at the same time, going to bed at the same time, and stress management as well. So again, the key really is going to be to keep everything consistent. As we like to say, the migraine brain doesn't want any change. The other thing is going to be keeping a migraine diary. So migraine diary is going to be very, very important. This will allow us to determine if the therapies that we have initiated are working or if they need to be changed. A really good diary that is available for your phone is called the Canadian Migraine Tracker. It is free to use and quite easy to use as well. So I highly recommend you download this and you get started. When it comes down to acute therapy, so this is when you're having your migraine attack, one of the core principles is that you want to treat the attack when it is mild in nature. I'll have a lot of patients who will say that they tend to let their migraine get more severe before they treat it. The reason we don't want to do that is because if we do that, the mild headache, once they get worse, the medication may not be as effective. So the best time to really treat your migraine is when the headache is mild in nature. Alright, so you may have heard this term medication overuse headache or medication rebound headache. So this is a concept where it's a vicious cycle that can happen where whenever you're overusing your acute therapy, it can lead to more headaches that happen down the road. This is where if you're overusing the triptans greater than 9 days per month, or simple analgesics like ibuprofen or acetaminophen greater than 14 days per month, or a combination of that for at least 3 months out of the year, this can potentially happen. So this is why it's very important to track how many migraine days you're having using the tracker app. And if you feel that this is happening, talk to the healthcare professional. They may need to consider changing therapies for you. And one of the therapies that can be initiated as preventative therapies. So this is where if you're again overusing your acute therapy, that can be considered, or if you're having a lot of migraine days per month, that can be considered as well. So this is something generally you would be taking on a regular basis to reduce your frequency and severity of your migraine attacks. Alright, well, thank you so much for taking the time to listen to this presentation. For your upcoming consultation, please complete any of the forms that was requested and send them back. Bring your medications with you or a list of it, and definitely bring your questions. I'll see you then. Thank you.